I don't like it one bit, but I'll support the Health Secretary tonight. The reason I'll do it, and I suspect the reason why there's such high public support for these measures, is because of the position the NHS finds itself in and the stage 5 ruling that we hear. But as we've then, by the middle of February, vaccinated the top 4 groups, who are the ones likely to overwhelm the NHS, does logic not follow that at that point we'll be able to lift the restrictions on our constituents' lives?
Well, I'll come on precisely to my honourable friend's point.
Prime Minister's commitment to it. But can I just take him back to the question from my honourable friend, the member for Winchester, because it's this point. He's very clear. Once we've vaccinated those 4 groups and they've got immunity and we've taken care, therefore, of 80% of the risk of death, what possible reason is there at that point for not rapidly relaxing the restrictions that are in place on the rest of our country?
We have to see the impact of that vaccination on the reduction in the number of deaths, which I very much hope that we will see at that point. And so that is why we will take an evidence-led move down through the tiers. When we've broken the link, I hope, between cases and hospitalisations and deaths, we will need to see those numbers we will need to see the protection in reality, in lived reality on the ground, but we will watch this.
But the logic of him anticipating what's going to happen in 2 or 3 or 4 weeks' time, from the number of cases we're getting at the moment, is that we can do the same in reverse. That is to say, when we have sufficient number of people vaccinated up, we can anticipate in 2 or 3 or 4 weeks' time how many deaths have been avoided. That means, since it cuts both ways, he will be able to make a decision on when we should end these restrictions, as my right honourable friend has just suggested.
The logic of the case that my honourable friend makes is the right logic, and we want to see that happen in empirical evidence on the ground. And, Madam Deputy Speaker.